Hey everyone, welcome back to the channel. Today, we're diving into a real-life medical journey that a lot of families sadly face: metastatic prostate cancer. Don't worry, we'll break this down without the heavy medical jargon. And along the way, we'll talk about the latest treatments, survival statistics, and what this actually means for patients and their loved ones. So grab a cup of tea, hit the like button, and let's talk about Mr. Smith's story, a retired accountant whose life completely changed this year after a sudden collapse. Back in April 2025, Mr. Smith collapsed unexpectedly and was rushed to the hospital. Doctors ran a CT scan, that's a detailed body scan, and found something nobody ever wants to hear. The cancer had already spread to his lungs, liver, and bones. They also found his PSA levels, that's a simple blood test used to detect prostate issues, were sky high at 135. Just to give you context, anything above 4 usually gets doctors concerned. This led to a clinical diagnosis of advanced or metastatic prostate cancer. Not long after, an MRI scan of Mr. Smith's spine showed that while he didn't have any dangerous spinal cord compression, the cancer had invaded the bone in his lower back area, close to key nerves that help with leg movement and bladder control. To help manage the pain and slow things down in that spot, doctors gave him palliative radiotherapy, basically a focused radiation treatment to ease discomfort and try to control the tumor in that region. By May 20th, Mr. Smith started hormone therapy, which is considered the gold standard first-line treatment for this stage of prostate cancer. Why hormones? Because prostate cancer typically feeds off male hormones like testosterone, and this therapy reduces those levels drastically, slowing cancer growth. According to the American Cancer Society, hormone therapy can control advanced prostate cancer for years in many patients, significantly improving both survival and quality of life. To be absolutely sure, doctors performed a liver biopsy, taking a tiny tissue sample. The results confirmed what they suspected: prostate cancer cells had spread to the liver. At this point, doctors had a full picture. The cancer had spread to multiple organs. It was confirmed through imaging and biopsy. And it wasn't curable, but definitely treatable. Now, this is where modern medicine really shines. Beyond hormone therapy, Mr. Smith's doctors proposed adding a new pill called apalutamide. Think of it as the next generation of anti-cancer pills. Instead of just lowering testosterone, it blocks the cancer cells from using any hormones they might still find. Clinical trials show that adding apalutamide to standard therapy can reduce the risk of cancer spreading or death by more than 30%, giving patients significantly longer and better quality lives. Alongside that, they're considering zoledronic acid, an intravenous treatment given every 3 months. This drug helps strengthen bones and reduces the risk of painful fractures, which is crucial since the cancer has already affected Mr. Smith's bones. Now, let's talk survival, because people always ask this. When prostate cancer is found early and hasn't spread, survival is nearly 100% over 5 years. Once it's spread to distant parts of the body, like in Mr. Smith's case, the 5-year survival drops to about 34%. But here's the thing, these are just averages. With today's modern treatments, many men live years longer than expected, especially with drugs like apalutamide and supportive care like radiotherapy and bone-strengthening medication. Mr. Smith isn't just a patient, he's a retired accountant, a husband, a dad of 2, and someone who loved staying active. Until recently, he was fully independent. Like many people with cancer, he's dealing with big lifestyle changes, from hospital stays to mobility challenges, but thanks to therapy, he's starting to regain his strength and quality of life. So what's the goal now? Doctors have been clear, this isn't about a cure, it's about controlling the cancer, easing symptoms, and helping Mr. Smith live as long and as well as possible. He's on the best treatment. We currently have hormone therapy plus plans for advanced medication, and has a great care team and supportive family beside him. If you or someone you know is facing prostate cancer, remember, early detection saves lives, so regular PSA checks are important. Now, let's talk about what patients can do at home to stay as healthy and strong as possible during treatment. Healthy eating. A diet rich in vegetables, fruits, whole grains, and lean protein can boost energy and help the body cope with treatment. Side effects. Research shows that a balanced, plant-heavy diet may even slow prostate cancer progression. Stay active. Light exercises like walking, swimming, or gentle yoga can improve strength, mood, and bone health. According to studies, men who stay physically active after diagnosis have a 30% lower risk of dying from prostate cancer compared to inactive patients. Bone health. Since the cancer has affected Mr. Smith's bones, calcium and vitamin D are essential, and weight-bearing exercises like light resistance training can help strengthen them. Mental health. Cancer isn't just physical, it's emotional too. Joining a support group or speaking to a counselor can reduce anxiety and improve overall well-being. Regular checkups. Frequent doctor visits help catch any treatment side effects early and allow for quick adjustments to keep patients feeling their best. Treatments today are far more advanced than even 10 years ago. And with the right care, people can still enjoy meaningful, active lives despite a stage 4 diagnosis. Thanks for watching this deep dive into a real journey with metastatic prostate cancer. If you found this helpful, please like, subscribe, and share this video with anyone who might need hope or information. And remember, knowledge is power, and no one has to face cancer alone.